So your role is pediatric specialist registrar working on children's ward in DGH, side room on children's ward. You're talking to Mrs. Mulholland, a mother of 5-year-old Harry. Harry is a 5-year-old asthmatic. He was admitted to ward 2 days ago with third exacerbation of asthma. He is receiving a course of oral steroids and is nearly ready to discharge home. After discussing him with your consultant, you wish to start him on prophylactic steroids. Prior to this admission, Harry was receiving salbutamol via spacer and was using this 4 times daily. He is otherwise healthy child with both height and weight on 25th centile. Harry's father was with him when you saw Harry on the ward round. He was happy to start recommended treatment. Harry's mother has come to ward and wants to talk to you as she's unhappy about Harry being on steroids. Please discuss to Mrs. Mulholland the recommended treatment for Harry and try to answer any questions she may have. Okay. If you want to read further, I will read further, or you can take time.
No problem. Just give me 1 minute.
Okay, when you are ready, just let me know. Okay.
Okay.
Okay, you can start. I have set the time now.
Yes.
Start.
Hello, good morning.
Good morning.
I am Dr. Adnan, one of the child and adolescent doctor here in this hospital. Am I talking to Mrs. Mulholland, mother of Harry?
Yes, doctor, it's me.
Thanks for coming to discuss about the condition of Harry. So before start, Mrs. Mulholland, do you want anyone to be with you?
No, doctor, I am alone. Please go ahead.
Okay. So, Mrs. Mulholland, may I know what is your concern about Harry condition and what's your biggest worry?
Actually, my son Harry has asthma, and for which he is on blue inhaler. He's using it regularly, and recently he was deteriorated too much and we came here. Now he's fine and the doctors want to discharge, but they want him to start on they said they want him to start on a steroid inhaler. I am very much worried about steroids, doctor. I don't want to be this to start. I need any alternative for this.
Okay. Mrs. Mulholland, I can understand your worries. Actually, you know, this asthma is a condition where airways become swollen and narrow. That make difficulty in breathing of Henry. So for this, we are using actually two different types of inhalers. Like the blue one, already Henry is using. This is we called Ventolin or reliever inhaler. And the another one which we want to start now, this is we called preventer. That actually contain the medicine steroid. Am I clear so far?
Yes, doctor, I know, but I am worried about the side effects of steroids. I have read, I have seen one of the child, he doesn't has asthma. He has some other problem for which he's taking oral medications, and he has put on weight, and I feel, and he fell down recently and he had fractures. When his mother told me that this is because of the side effects of steroids. So I am worried my child may also have these problems in future if I start him on steroids.
Yeah, your concerns are very real. Uh, a- as if we are using this steroids in the tablet form, there are these side effects which you have already mentioned me. These may happen, but in the Henry, we will start as in inhaler form. Okay, this will be very minimum dose, and all these unwanted effects are very rare to come across. Okay.
Okay, does this local form, it will not have any side effects, doctor?
Yeah, it may have some effects. You are right, but these unwanted effects, which you have already mentioned, this is very, very rare to with inhaler form. But still, there are some like they may have some spots in the mouth. We call it oral thrush, or they may have effect on the growth sometimes. But as I told you, we are giving in very minimal dose, so it will be very rare to Henry have these unwanted effects. Are you with me?
Yes, doctor. So what about now? He is growing well. I am worried about his growth also. There can be some problem in his growth in future.
I will tell you that this, this if poorly controlled asthma has more negative effect on the growth of the child itself rather than inhaled steroids. And sometimes we, as a being doctor, we should weigh the benefits against the risk. So if his asthma will not be controlled, it will affect his growth more severely than inhaled steroids. Uh, are
Okay.
you getting my point?
Yes, yes, doctor. I understood now.
Mm,
Uh, so,
yes.
doctor, is there instead of steroids, you can give him some other medicines which can control his, which
Ac-
can prevent his attacks. There is no other option.
Actually, there is no alternative for that. What happened in the asthma? As I told you in the beginning, this is a condition where is swelling of the airways and narrowing of the airways. So if we will continue use this flu inhaler, it will get Henry will get relief, but it will be for short period of time. And this swelling only be get relieved by using this preventer inhaler, that one orange one, steroid. If we will not use this, its swelling can damage airways and may cause deformed airways. Are you with me?
Yes, yes, doctor. I understood.
So I'm really sorry that there is no specific alternative for this.
Okay.
Do you have any other concern?
Uh, yes,
Mohan?
doctor. About the follow-up, I want to know because this time 3 minutes left. Okay, this time he had too much of problem. So when should we follow up with the doctor after we start, and how early can we stop these steroids?
Yeah, that's a good question. Actually, we will monitor his condition, and we will carefully monitor his condition, and we will keep Henry in follow-up. As this all children have different reaction to these inhalers, so whenever his condition will be improved, we can stop, and we I can also arrange a meeting with a doctor who is uh, specialized in this field. We can You can also raise this concern with him, and we will also look after his for unwanted effects also the same time. So I think this will be a good idea. What do you think?
Yes, doctor. Actually, now for to control his asthma, I am ready to start the steroids. But my aim is to stop it as soon as possible. This is why I was thinking that I need a good follow up, and
Yes,
maybe we can stop it as soon as he's controlled.
yes, yes. When he will be controlled, we will definitely will think of that. And I will tell you that we all here for the best in regarding the health of Henry, and we will keep him in follow up, close follow up. Okay, that's
Okay,
okay for
okay,
you.
okay, doctor. Okay.
So, Mrs. Mulhelen, if you don't have any other concern, may I summarize what we have discussed today?
Yes, doctor. Please.
Yeah, as I told you, Henry is having a condition we called asthma, and I have discussed about what is asthma and how we can prevent the further attacks of asthma. Okay, for that we need to start steroids, and with inhaler form, there is very much minimum unwanted effect, but still we will keep him watching, and we will close the follow up him for unwanted effects, and again for his improvement of the uh, condition, I mean to say asthma. So I will advise you something also, which you should, whenever you will use this inhaler, you should rinse the mouth of Henry. As I told you, this may cause uh, rash in the mouth. And some other triggers which I want to tell you that you should avoid, like smoking at home, or if you have pets at home, that may trigger the asthma. And carpeted floor should be changed with the laminated floor. Okay.
Okay, okay, doctor. So time finished, huh?
Okay, thank you.
But you did
Thank
not
you very
give
much.
leaflets, I think. Did you tell
So
about?
I will give you some leaflets at the end. You can go through that. Thank you very much.
Oh, okay. Yeah. Okay. So I think you introduced yourself. It was good. Attender was asked, but for the previous knowledge, you went directly to the concerns, right? You don't.
Actually,
Uh,
why I did not ask, because this was in the ward setting. So here, mother raised the concern. So I have to ask first, what is the concern?
okay. Shouldn't you ask about the previous knowledge? Like, what do you know about your child's condition or what?
Yeah, we can start from there, because here they have written that mother has been raised the concern. So first question always, whenever the mother has concern. So this is not from our side. We are giving information from mother side. So we can directly go to concern also. I think so, because mother is having the concern.
Okay, no
As a,
problem. Anyways, your question was like both previous knowledge and concern.
yeah,
It
yeah,
includes
that
that, but I
that I
don't know
can.
in the exam, maybe the examiner may think that you did not ask. This is what, just be careful.
Okay.
Otherwise,
Okay.
your reliever preventer explanation was good. Narrowing of the air pipe was also good. But maybe if it is not online exam, if it is face-to-face exam, you need to draw the pipe and show her that
Yes, yes,
become
yes.
narrow
I know.
inflammation.
Yes.
This is one thing. And you told benefits versus risk. It was very nice. For the when she asked about, she is very much concerned about steroids and she wants to stop it as soon as possible. That was also right. That you will refer her to the. Can we use pulmonologist as lung specialist?
Pulmonologist we cannot use. This is jargon. Lung specialist we can use, but you can say just the doctor who is specialized in this, because uh, they are not referring directly to the asthma. There is asthma team. So initially they will go to the nurse, asthmatic nurse. So she will decide further to. Actually, in the UK, they are sending to nurse, asthmatic nurse. This
No,
asthma
the
nurse.
stepping up and the stepping down treatment will be decided by whom?
Yeah, that one is consultant. That one is consultant. So
Oh,
you can just say that who are specialized in this field, or you can use the lung doctor also. No
Yeah,
problem.
lung doctor or lung specialist. And also you
Yeah.
can tell her, I think there is something called step up and step down of treatment, which will be decided by the lung doctor or lung specialist. So he will follow up your child and he will decrease the dose if it is well controlled like this. Decrease, or
Yeah.
if needed, he can stop. This is
Okay.
called step down like this.
Okay.
This is what I wanted to tell. Otherwise, your answer was fine. Uh, I think we can add step up and alternative. We cannot say that there is some like this Monteculast or something. He's
No,
borderline. He's
that,
5 years.
yeah, that one is coming in the step three. Now this what they are following this PTA,
Yeah,
British
yeah, yeah.
SURAH. They have written that this is the first is steroid inhaler they are starting now in the minimum dose. So LTRA is coming on the third. So we cannot say that this is the alternative.
Okay, fine. I got to know according to the recent ones. Okay.
Yeah. So here, which I know, seniors are saying that you should tell about the triggers also by yourself. Even mother is not off.
Yeah, you're right. She may, there is also here in the, this I saw, like here, there is triggers also can be a concern.
Yes.
Discuss known trigger factors or precipitants if this is an area of concern. So yeah,
Mhm.
you have to discuss about it, and also about the local side effects of the inhaled steroids like this, as you said. What we have to rinse the mouth to prevent oral sores. We can also use the word oral sores otherwise,
Yeah,
right?
oral code. Yes,
Oral
yes,
sores or ulcers and sore throat.
yes.
Okay, I think it went well. So anyone has any comments before we move to the next?
May ask
Okay, go ahead.
whether this steroid inhaler will act immediately like the reliever medications, that is the salbutamol inhaler. So it is written that it takes about 7 to 14 days for the steroid inhaler to build up its effect. So this means that it may not give any immediate relief of the symptoms like a reliever dose, but usually after a week, the symptoms have often gone. And sometimes it may also take up to 6 months for the maximum benefit. So this might be a question from the role player about the difference between the preventer and the reliever medication.
Yes, Dr. Bonali, you are right. But if mother asks you, then only you can say. Otherwise, you.
No. I was not, it is just for an information I told this, that
Yeah,
there
yeah,
might be a question. Just if it might come, so just for an information.
yes, yes.
Thank you.
Here actually you have to tell that about this why we want to start steroids. So here is the actually asthma is chronic inflammatory airway disease. So we just want to start to this treatment of the soreness or swellings of the airways. This is the main thing.
Yes.
So this is the new chart. We have to remember there are two things. One is for 5 to 16 years. Another is less than 5 years. Okay, this is for 5 to 16 years. Okay, this is newly diagnosed asthma in children and young people aged 5 to 16 years. Okay. So here what happens? Symptoms that indicate need for maintenance therapy at presentation. This is one thing. Or for infrequent short-lived wheeze and normal lung function. If it is just short-lived wheeze and normal lung function, you will just consider SABA alone, means short-acting beta agonist alone. But if the symptoms indicate that they needs maintenance therapy, that is a preventer therapy at presentation, what is your first step? This is the first step. Offer pediatric low dose corticosteroids, okay, inhaler corticosteroids, ICS, with SABA, that is short acting. If then how long? The mother was asking about follow-up, right? So you will follow the patient in 4 to 8 weeks, okay? If asthma is uncontrolled in 4 to 8 weeks, means you will follow him up whether with this treatment he is showing response in 4 to 8 weeks or not. Then if it is not, then you will consider what? Low dose inhaled corticosteroids plus leukotriene receptor antagonist, okay? So LTRA. The next step is, along with whatever treatment you are giving, you will consider LTRA. Again, you will observe the child for 4 to 8 weeks, okay? If there is no improvement, you will stop this LTRA and you will start long-acting beta agonist. This is the third step. Again, in 4 to 8 weeks, you will see if it is uncontrolled, then you will go for MART regimen. Okay, what is MART regimen?
This is actually MART regime is salmeterol and with the steroid.
Means this like, yeah, I got to know. Means long-acting
yes, long-acting and
salmeterol plus one steroid, right? Which is also long-acting.
Yes.
Yeah. There is a standard name for that combination. I'm not getting.
That one is, I think, seritide or something like that.
Seritide. You're
Seritide.
right. And it comes purple in color. That also. Yeah. Yes. Okay. So you will consider again low dose inhaled corticosteroids plus LABA with MART regimen. Okay. Again, if asthma is uncontrolled in 4 to 8 weeks, consider pediatric moderate dose. So now you changed from low dose to moderate dose plus LABA, and either within a MART regimen or as a fixed dose. Okay. So along with the MART regimen, you can change low dose to moderate dose. Okay. Then still, if asthma is uncontrolled in 4 to 8 weeks, consider seeking advice from healthcare professional with expertise in asthma. So you will refer. If till this step, if you cannot, you will refer. Consider pediatric dose inhalational corticosteroids plus LABA as a fixed dose. This will be done by the mostly by the pulmonologist or asthma team. You can say one word, asthma team, which may include the pulmonologist, the nurse, and everyone. Okay, so this will be done by them. Consider continuing pediatric moderate dose inhaled corticosteroid regimen with trial of an additional drug, that is theophylline. So these are the steps we should know. Any idea why this is here it is reliever and here it is preventer, or what? This dark orange and light orange. Any idea?
It is maintenance.
Yes, written up. Up. You can see that line marks up. Yeah, on the right side, up and right.
Yeah, you're right. Maintenance therapy and symptom relief. Okay, I guessed and it is correct. Okay, fine. So here, consider decreasing maintenance therapy when asthma. See here, consider decreasing maintenance therapy when asthma has been controlled with current maintenance therapy for at least 3 months. So if this question comes of the follow-up, Dr. Rohel explained very well. Maybe we may not remember 3 weeks, 4 weeks, 8 weeks, 3 months. If we don't remember, we will just tell, we will refer you to the lung specialist and he will step down your treatment if your child is well controlled. Or also if it is not controlled, he will decide to step up. So it is his decision. You can tell that. But here you can remember 4 to 8 weeks, they will have regular follow-up. If it is uncontrolled in 4 to 8 weeks, they will step up. But if it is controlled, you will see the child at least for 3 months before stepping down. Okay, because here he has written very clearly, consider decreasing maintenance therapy when asthma has been controlled with current maintenance therapy for at least 3 months. You will step down only if it is controlled at least for 3 months. Okay. So if we see this chart, it is very important. This one, what I am sharing now, both for history also, it's very important. So now we will go to our second case. 2 minutes and we will start because it's prayer calling time. So our next case is neonatal registrar working in a busy tertiary level unit, side room on neonatal unit, Mrs. Levis, mother of 2-week-old Bernard. Background information: Bernard was born at 25 weeks gestation, weighing 700 grams. He is now 2 weeks old and remain ventilator dependent. Clinical assessment and subsequent echo scan shows a large PDA, patent ductus arteriosus. It has been planned to start Bernard on medical treatment with indomethacin. You need to explain, Mrs. Levis, the treatment plan and potential outcome of the medical therapy. PDA is common and approximately 8 in every 1,000 children have some form of CHD, and of these 15% have PDA. We have to see the recent percentage if it is the same or not. Almost all preterm babies born at 25 weeks gestation like Bernard will have patent duct. A patent duct is normal before the baby is born and most close at 1 and 6 weeks of age. Draw a diagram, and this makes it much easier to visualize and understand the diagnosis. This is under breaking bad news, okay? The scenario is under breaking bad news, but you will use a diagram to make them easier to visualize and understand the diagnosis. Explain that normally pink blood and blue blood do not mix. However, the duct allows two to mix. Without treatment, we are likely to make any progress in reducing respiratory support. Without treatment, we are unlikely to make any progress in terms of reducing respiratory support that is coming off the ventilator. Means we cannot wean him off the ventilator without doing some intervention to close this PDA. Okay, this is because there is excess of blood flow to the lungs, which makes them wet and stiff. You will explain like this. The treatment involves administration of indomethacin. Think of this medicine as similar to strong aspirin. There is no guarantee that this medicine will work. The typical response rate is 50%. The side effects of indomethacin include renal impairment, although this is always transient, reduced urine output, and weight gain. Okay, so they may have renal impairment, which may cause reduced urine output, and they may gain the weight. Okay, but this will be a transient effect. However, Bernard's progress how will Bernard's progress will be monitored? He will need a follow-up scan at the end of treatment course to find out whether the duct has closed. For those babies who do not respond to treatment, the next step in management is surgical ligation, but this would be discussed with Mrs. Levis at a later date if become necessary to do so. Confirm her understanding and ask whether she has any question to offer for her to have meeting with Bernard consultant. Okay. So this is the case and Dr. Yasser is our candidate. Okay, Dr. Yasser, I will share the board for you.
Yes, yes.
You can draw, and once you're ready, tell me. The time is 4 minutes, but since we read the scenario, I will keep 3 minutes time, okay?
Okay, no problem. Uh, uh,
Okay, start.
yeah. Good evening. My name is Dr. Yasir. I'm the treating physician of Bernard. I think you are Mrs. Lewis. Is it right?
Yes, doctor, it's me.
Yeah. How are you, Mrs. Lois?
Fine, doctor. I am worried about Bernard.
Okay. How is Bernard?
He is fine, but he is on breathing machine. Still,
Mhm.
now he's 2 weeks old. Since from 2 weeks, he's on breathing machine. I
Mhm.
don't know, doctor, how you will, what else he has, what problem he has, how can we bring him out of this? And he's very small also. His weight is just 700 grams.
Okay, Mrs. Lewis, first of all, I congratulate you on the birth of Bernard. But I understand your concern. But you know, as Bernard was born before the time, and he was born at 25 weeks, and normally babies are born at 36 weeks. Due to this problem, there are some problems that are present before the birth. They are still present in the Bernard, and that causing some problem. So that's the reason the Bernard is on machine that is help is in for breathing. Do you understand me?
Yes, doctor. Can you tell me what problems he have? I thought he has only problem in his lungs. That's why he's. Does he has any other problem which is causing it for him?
Yeah, I highly appreciate Mrs. Lewis your concern. That's right that his lungs are not so much mature that helps him to comes out of this machine. But we did his echo, in the heart ultrasound, jelly sound, which showing that as I show you the picture, this four chamber is our heart, and there is a pipe that comes out. The out downstairs is the lungs.
Okay.
Here this one. Okay, and normally here there are two type of blood in a body. What is called red blood and other is called blue blood. The blue blood comes from the right side, and it comes to the lung, and when it comes to the lung it becomes red blood, and red blood go to the left side.
Okay. Okay, doctor.
Okay, this is normal, and from the heart, this is the outlet pathway. We call it as the heart vessel. We call this aorta. Through this one it comes out. But as you know, the Bernard was born before, and there is a connection between this large outlet blood vessel with the uh, uh, this one outgoing ingoing to the heart, this inlet blood vessel. So this
Okay.
communication, we call it PDA. That is called, it is a patent ductus arteriosus. This is a medical term. Don't be confused. I will tell you what is this. Are you with me?
Yes, doctor, I am with you, but I am now afraid. My baby has heart problem, you mean?
No, no, no. Yeah, yeah, he has heart problem. But normally, when every child has this problem, but normally when he born, this duct, this tube will close automatically up to 6 weeks. But as I already told you that Bernard was born early, so this duct was unable to control. Do you understand, Mrs. Lewis?
Yes, doctor. Now this early borning, the birth of my child being early is creating lots of problems. Now I thought it's lungs. Now you're telling heart, and tomorrow you will tell something else. I am very
Yeah,
much
yeah.
so.
Okay.
How you will solve this problem now? Can he come out of this breathing machine? Do you have any solution for this?
Yeah, yeah. We have a solution. First of all, we are using some medication. The medication name is indomethacin. Have you heard about this medication?
No, doctor. All these things is very much new for me. So what do you
Okay.
do with this medication?
We can use this medication and hope so. We are not guarantee, but we assure you with the use of this medication, this abnormal blood vessel, this tube, blood tube will close. Do you understand?
Yes, yes, doctor. But maybe my baby is just 20, very small. I told you, weight is
Okay.
very less. Maybe it will have some side effects. Don't you think?
Yeah,
For small
yeah,
baby,
yeah.
how can we give medications like this?
I understand your concern, Mrs. Lewis, but it is usable, and there is literature is available that uses its efficacy. Although it has very side effects, lower side effect, just like it affects the kidney, it causing decrease urine output, it causing
My
increase in
God.
birth weight.
Maybe, doctor, this may damage my child's kidney. I don't want to go for this.
I
Have
understand
any
your concern.
alternative for this?
At the moment, Mrs. Lewis, there is no alternative, but because her
Minutes,
because we are
3 minutes left. Okay, 3 minutes left. Okay, go ahead.
okay, 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 Mrs. Lewis, I just want to assure you the her benefits are more than his out side effects. As you know, uh, due to this abnormal blood vessel, this Bernard is unable to, lungs are unable to breathe. So that's the reason at the moment this is the best choice for him to use this medication, and I hope so we can come out this one. But you don't be worried. Whenever we administer this drug to Bernard, we can monitor him, and he is in in a good hospital setting, and we are here to help you. Are you with us?
Yes, doctor, but what do you think? Because I am afraid of this medicine and its side effects. Why don't you, what about the surgery for him? Can it be closed by doing something?
Yeah,
Uh,
yeah.
doing some
First,
surgery or
yeah,
something?
yeah. I understand your concern, but first, it's better we can use medication. If it is not controlled, then we can go for surgery later on. But for that, we have to consult you again, and we involve the heart people. They will discuss with you about this problem. Do you understand?
Yes, I understand, doctor, but I am asking you, without giving this medication, why can't we go for the surgical? Because I feel that there won't be any effect on the kidney.
Yeah, appreciate your concern, Mrs. Lewis, but because his condition is not up to that we go directly to the surgery. So that's the reason we are using first medication, and later we can go for this surgery. Are you with me?
Yes, doctor.
Do you have any other concern?
No, doctor, but I am very. Will my baby be fine after this? Don't you think there may be more problems after doing this medicine?
I told you already. Every drug has a side effect, but there are benefits are more than its risk side effects. So that is better we can use. You don't be worry. I will arrange a meeting with my consultant and also the heart specialist. They will guide you more regarding this medication. I think Mrs. Lewis, we have discussed about the disease. As you know, Bernard has born before the time, and due to that he has some abnormality. There is uh, a blood vessel present that has to be closed after birth. Due to that, his lungs are wet, and he is unable to out of the machine, this ventilator machine. But we assure you that by
Sure.
using this medication, we assure you by using this medication, we hope so he will come out, and that abnormal blood vessel will close. If it is not happen, then we go for surgery. But I think we will arrange a meeting with our consultant and the heart specialist, and they will give you more answers about your worries.
Okay,
Oh,
doctor. Okay.
thank you.
Leaflets. Did you give the leaflets?
Oh, sorry.
Okay.
I will provide you leaflets and some websites. You can get some information more. It will help you to resolve your questions and queries.
Okay. Thank you so much.
Thank you.
Okay. So before giving the comments, I want to tell you, can you explain your diagram, please? This is, these tubes are going to lungs. You mean, what is, this is pulmonary artery, you mean? And this is aorta. Hello? Hello?
Yes, Dr.
Yeah, you
Noor.
can hear me. You can hear me.
Wait, I will mute all. Just Dr. Yasser open. Okay, I can hear you, but really I did not understand your diagram.
My drawing is very poor. Sorry.
No, I want to make the diagram more easier because this is what, okay. Tell me what is, where is aorta here? Tell me. This is
This
lungs.
is the one that going down.
This is
Yeah,
lungs.
this is
Right?
lungs. Yeah.
Yeah. This is pulmonary artery.
Yes.
Okay. Is this aorta? Where
This
is the aorta?
no. This is pulmonary vein. This is pulmonary vein.
This is pulmonary vein. Okay. And
Yeah.
here is the aorta. This is the aorta.
Yes, this is the aorta, but because I am not used to for this one,
Yeah.
so
No.
it's
Your
erased.
drawing should become more easy and flexible so that they can understand. Okay. There is some problem in the drawing, I feel, but I don't know about others.
No, it's become confusing. I tried a lot, but I cannot find out the
Let us
exact
draw
picture.
again and see. This is one comment about the drawing. The other thing is you should, empathy and sympathy should be more. The same problem with me also. I also have this problem of speaking long, and empathy and sympathy. Because this is breaking bad news. For everything she will tell, oh, my baby is small. Now you said heart, then lung, then kidneys, and you have to tell, I can understand your feelings. You're good. In one time say, I can understand your feelings. Second time you can say, you're going through a difficult situation. I know you are going through a difficult situation, but we are here to help you. Then first tell this sentence, some sentence, and then go to the conversation. This was lacking in some places. Like as in one place you said, I appreciate your feeling. Very good. Next, I can understand you are going through a difficult situation. Next, I know you are feeling very bad, but we are all here to help you, to support you. Like this, give different sentences. For different sentences, there are sentences, but I always think that I should go through, but I haven't gone through till now. Okay. So we should
Yes, you are
practice
right.
different sentences. This was lacking. Otherwise, your explanation was okay. And in the chats, I read that endomethacin is used to close duct nowadays, question mark. I think it is not used. Ibuprofen is used. So any
Now ibuprofen.
No, no,
Now,
no. It
yeah,
is using.
in NHS leaflet you can see there is written ibuprofen.
Yeah, yeah. Ibuprofen only in premature babies and indomethacin in mature babies.
okay, now this is
Here you are talking about premature baby.
Yeah, yeah. You are right. You are
this
right.
is the recent guidelines is ibuprofen. Okay, no problem.
Yes.
We just did this scenario from Rebecca because it can come to us, but just we should know the changes. This is what is my point. Otherwise, you are okay. The only two problems is speaking long. And here in Breaking Bad News, what happens more than information, empathy, sympathy should take more time. Okay, they may start crying also. You need to offer tissue and also empathy, sympathy if they start crying. Okay, and everything you explain, before explaining, give her some good sentence and then explain. This is what I wanted to tell you. Otherwise, it was okay. Next, I want.
It was very long sentences. Like simple word you can say about the PDA. This is a pipe that is this is a pipe that connects the uh, big blood vessels that's coming to the lungs and to the whole body. So simple word. Okay, that's usually closed after birth, but it remains open while the child is in the womb, because in the womb the child's lungs are not working, so blood is bypassing the lungs. So that's why there is a connection between these two blood vessels. But after born, this blood vessel should be closed. But what happened in your child's case, this is still open. So we call it patent ductus artery. So just half a minute you can give the explanation. Diagram you can, if the online, but in the online you will not make the diagram. They clearly said. Okay, Dr. Noor.
Yes, I want to tell one more thing. He told echo, then he explained jelly scan of the heart. So just say for the echo, the best thing you will say is the jelly scan of the heart. It's enough. No need to take the name. Maybe
Even they are saying, I just asked a few days back one of consultant in UK. So they are saying that just no need of jelly scan. Just say that heart scan or brain scan, kidney scan. That's enough more than no need of word use jelly.
just heart scan, kidney
Yeah,
scan,
heart
brain
scan, kidney
scan.
scan, brain scan. And in the while, she may ask you why this is uh, not getting off from the breathing machine. So just say that this PTA patent of start increasing the blood flow to the lungs, and this is make harder for the baby to breathe. That's why we cannot wean off from the breathing machine. Or just what Rebecca has said, that it increasing the blood to the lungs, and lungs are getting wet more. That's why I'm getting wet and stiff. So that's why we are your child is facing difficult to get off this breathing machine.
Okay, and also I want to tell you, you told starting physician. I feel just tell baby doctor. I think it's enough. What do you say? I don't know, even my drawing is not good, but what I want to tell to the mother is, you have to tell that the heart is divided into 4 chambers and there are 2 vessels coming out of it. Just draw here. Okay. And draw here. This one you draw small and the another vessel you draw big. Okay. Okay. And tell her that there is a connection between these two. Okay. And always the blood will flow from the bigger vessel to the through this connection to the smaller vessel, which will go for the lungs. So this is the reason lungs is receiving more blood, and because of that they are wet and stiff, and the baby has more breathing problem, and we cannot remove the baby out of the lungs. I think it's enough to draw two tubes showing that one is from the right side of the lung. It will go to right side of the heart. It will go to the lungs. If you want, you can draw the lungs also here. Okay, and showing another that the left side of the heart, it will go to the whole body. Always the blood will flow from bigger vessel to smaller, bigger tube to smaller tube. So the blood will flow here through this connection, and it will make the lungs more wet and stiff. This is the reason we cannot bring your baby out of the ventilator. So if anyone can make it more simple, can make, if you know, can draw. What do you say, Dr. Adnan?
Yeah, this one this draw is much better. So you are
Only
clear. Yeah,
just show two tubes and the connection. That's it. No need to
yes,
show
that's
any
good.
other thing. If you want far away, you can draw lungs here. Okay, you can show, because if drawing in the computer is difficult for me. Far away, draw the lungs and show that this
Yes.
tube will go to the lungs.
Even Dr. Noor, if you want to tell that complete about the heart, like there are 4 chambers in the heart, 2 is on the right side and 2 on the left side. The right side is blue blood is coming, and that is less oxygenated, and the left side pink blood is coming, that's well oxygenated. So from there, from the right side, blood is going to the lungs, and from the left side, blood is going to the
Whole body.
whole body. So between 2 pipes, there is a connection that's usually present when child is in the womb, but it could be closed when he born. But what happened in what's name condition? It's still open. We call it patent ductus arteriosus. So 1 minute, you should come to the agenda.
Yeah. So this drawing and all we will do before in 4 minutes. So no need to waste time when we are in the station for drawing, because in face-to-face exam you have to draw. You will be given the paper and pen, everything.
Yes, yes.
Okay,
Because
that's
you are going for you are not going online, so you will have to draw there.
yeah, we have to draw this. Or there is one more option, like just draw like a heart, if they can understand. And also you can make 2 tubes from the heart in the same way how I did. Okay, and just make 2 tubes, one from the left and one from the right. If you have color pens, if you have time, you can use different colors, that is also fine. And then just show the connection, that's it. And explain to her that always draw the, I haven't drawn here, but always make this left side pipe bigger, right side pipe smaller, to make her know that the blood will flow from left to right, because it is normal understanding that anything big will have more pressure, and it will flow, and there is mixing of blood here. This is why the lung is wet and stiff, and you are difficult to bring him out. This is the reason you want to give now for him. So in recent scenario, it will be ibuprofen. You can tell the medication name and explain that this medication will help. Is the side effects of ibuprofen same like indomethacin?
Yes, there
May
are 2
cause
main
reduced
side effects.
urine output.
Yeah,
All
2 main
NSAIDs
side
have same. All NSAIDs have same side effects. Takriban.
effects.
Okay.
Yeah.
And I want
Two,
to this tell you,
problem.
when she asked about why not to go for surgery instead of medication, you could have given 2 answers. As you said, benefit versus risk, one thing, and another thing here it is mentioned that although this is always transient, so you could have reassured her telling that this side effect will be there, but it is just for a short time, not for a long time. So
Yes,
but bearing a surgery on a small baby who has less weight will be more stressful for the baby, like this. Okay, So in that way, you will prefer medicine over surgery like this, because keeping the kidney in her mind, it affects kidney in her mind. She is preferring to go for surgery. This will be the thinking of the normal people, right? So we have to make them understand that trying with medication is better than the surgery, because whatever side effect I am telling is just for a short period of time. It will not last long. Okay, this you can tell the answer. Another thing is surgery in this age will be more stressful, and it will be considered only if this effort is failed. Okay, and also
One
if,
one
yeah.
sympathetic phrase can be used when you ask that my child is facing too much or something like this. You did ask that now heart problem and other problem. So you can use that I'm really sorry that this is not what you have expected for your child. So he is facing too much. This is not what you have expected for your child, coming child or newborn child. So this is a good in sympathetically. Okay.
Okay, yeah.
Yeah.
And anyone, what about the response rate to ibuprofen? It is the same 50%, because any updates from the recent anyone has gone through? Because here it is given, there is no guarantee that this medicine will work. The typical response rate is less than 50%. And this is large PDA. Okay. We have to check this. Okay. All the numbers, whatever he has given, we have to go go back and check this. The like 8 in every 1,000 children and 15% are PDA, and 50% less than 50% will respond to the treatment. Okay. All these things we have to check.
Actually, ibuprofen also will give the same effect, but only thing advantage over indomethacin is that the side effects are not that much. But nowadays, paracetamol IV is the one using priority.
They are using paracetamol.
IV.
I don't
Only
know.
for 3 to 5 days.
NHS recent guidelines.
There is no side effects. Most of them close. If doesn't close, then they do go for surgery.
Dr. Suzanne, is this from NHS? Any leaflet you have recent one or what?
This is what we have been doing. I didn't check any
Huh?
leaflet.
Or
This
you
is
are
what this is what we have been doing there. But so I didn't check any leaflet now. But this is the one written.
okay.
Even they are using paracetamol for 5 days for this closure.
Yeah,
In
3 to 5
guidelines.
days.
3 to 5 days. Yeah.
Every 6 hours, 4 hours like this or what?
Yeah, actually 6 hours. Every 6 hours, 10 milligram.
Every 6 hours, 3 to 5 days, 10 milligram per kg.
And there is no side effects.
Yeah, there is no side effect for that.
And also you can feed the baby. Because when you are giving ibuprofen or indomethacin, then you will, because there is a problem with the gut. So you may not feed. There can be some ischemia to the gut.
There can be some what?
Ischemia to the gut, because there is gastric problem will be there, no? Yes. When you give ibuprofen or indomethacin. And that is one another side effect.
Yeah, they can causing the mucosal erosion, and there are chances of perforation and septicemia.
And also they can lead into NEC.
Ibuprofen also causing bleeding problem.
Same side effects, but the severity is a little less for ibuprofen. Anyway, we will check.
We can go through the leaflets. If there is any change, we can come back.
Good morning, good evening. It is written in guideline. The first line is ibuprofen. If no response or contraindication, paracetamol is the second line.
Okay, which neonatal guideline you mean?
Yes, in unit guideline.
Okay, thank you. Send us the page number also.
Ibuprofen is first line. If there is contraindication to ibuprofen or there is a first line, second line is paracetamol. Paracetamol there is only issue regarding his can affect the mental or not, can affect the brain of the developing child or not.
Okay, thank you so much. So I will mute all and we will proceed for our next scenario. There is some change. Actually, I told 135, but we are doing page number 125 because for the candidate, I messaged wrong page number. Okay. So there is change. We are doing scenario 125. It is also breaking bad news. Okay. Dr. Barnali, you are here.
Yes, Dr. Noor, I'm here.
I will read the scenario for you, then we will start. So your scenario is side room, postnatal ward. Mrs. Janine Tall, mother of Billy, now 12 hours old. So background information, Janine Tall, a 42 years old librarian, delivered her third child at home. She was then transferred to the postnatal ward for checkup. Janine and her midwife noticed that Billy does not look like her other children and have therefore asked for a pediatrician to assess the baby. Your SHO has seen Billy and reports that there are clear features of Down syndrome. Please break the news to Mrs. Tall that you believe that Billy has Down syndrome. Okay. Points to consider. Offer your congratulations on the birth of Billy. Does Mrs. Tall know why you have been asked to see her? Does she have a partner, friend, or relative whom she would like to be present? Make sure that a nurse or midwife, preferably one who knows the mother, is present. Anyways, although no one will be there in the scenario, just the role player and you. Ask Mrs. Tall whether there were any concerns during pregnancy. Did she have any form of antenatal screening? Be honest and open. State that you feel it is very likely that Billy has Down syndrome, which will need to be confirmed by a blood test. Ask whether she heard about Down syndrome or knows any children with Down syndrome. Explain the diagnosis of trisomy 21, 3 copies instead of 2 copies on chromosome 21, the most common cause of severe learning difficulty. It is common, occurring in 1 in 1,000 live births. There is a lot of information you could give her, but for now, offer small amount and acknowledge that this is difficult time for her. Explain briefly the clinical features and associated problems, heart, thyroid, eyes, and the need for multidisciplinary team involvement. Emphasize that children with this condition, particularly those without a heart abnormality, do well without requiring much medical input. As far as you know, Billy does not have heart problem. Okay. Immediate management is to encourage bonding and discuss breastfeeding. Summarize and check Mrs. Tall's understanding of what you have told her and arrange a second meeting when you can give her further information. Provide her written information, contact details, including telephone support numbers and relevant websites. Okay. I think you can draw because you have to explain her about the diagnosis trisomy 21. Okay. I will share you the whiteboard, and once you are ready in 2 minutes or 3 minutes, let me know. Okay.
Dr. Noor, do I need to draw the chromosomes for a mother? Because
least you have to show her that there is the extra genetic material than normal.
Mhm. Can I just proceed with? Can I just proceed without the drawing?
Okay, as
If
you
it's
like, no problem for me.
Yeah,
Okay, when you're ready, just let me know.
just half a minute.
No problem. You can take your time, 1 minute, 2 minutes, no problem. You can start.
Hello,
Hello.
I am Bornali, one of the baby doctors of this hospital. I believe I'm talking to Billy's mom, Jenny.
Yes, doctor, it's me.
Okay. Congratulations, Jenny, on birth of your beautiful daughter, Billy. How are you feeling and how is Billy doing?
I'm very happy, doctor, and Billy is fine. No problems with her. Anything, doctor?
Yes, I have been asked to sit with you to discuss about an issue regarding Billy. Is it the right time and will it be comfortable for you to discuss this with me now?
Yes, doctor. Yes, I feel she's fine. I don't know. Is anything wrong with her?
Actually, Jenny, we have the midwife discussed with you anything regarding Billy?
No, doctor. Nothing is told to me.
Okay, so we have examined Billy and have noticed some special features which are of concern and suggestive of a medical condition called Down's syndrome.
What? I don't know what syndrome is it, doctor? I haven't heard any time. Is my daughter fine?
Please, Jenny, please don't worry because Billy is doing good now. And I think you have seen Billy a few minutes back. What do you feel about Billy now?
As far as I know, she's fine. And some doctors came to see her. That's it. Now I am worried about this, some problem you're telling. Is everything fine, doctor?
Yeah, this is why I have come to discuss with you. Do you, Janine, do you feel that Billy appears to be different from other newborn babies?
Yes, doctor, but I thought it's maybe she will be fine once she's fine when she grow old.
Okay, so what we have noticed when we have examined Billy, that she appears to be a little bit floppy.
Okay.
Have you also noticed about this? Have you also
No,
noticed about
doctor,
this?
no, I did not notice.
And some of the features we've also seen that her hair on the head appears to be low down with an excess skin in the back of the neck.
Okay.
So, Jenny, have you noticed anything unusual about her eyes or the ears?
Yes, doctor, but I feel that she is small. That's why I am seeing like that, and she'll be fine.
So, as we carefully look, we notice that the eyes is slanting upwards. Her ears are low down, and the top of the nose appears to be broad.
Okay, doctor. So now what you want to do with Billy and is there any treatment to come out of this condition? Only she is looking like this, or she will come out of this? Can you please let me know?
Yes, Jenny, as I have explained to you that after noticing these features in Billy, we are suspecting about this condition which we have already called Down syndrome, which is a genetic condition.
Okay, so what happens in this?
In this, as I have already told you, that this genetic problem occurs due to an abnormal number of an extra genetic material in our body.
Okay, there is extra, you mean there is extra genetic material? Are you sure now she has this problem? Are you sure 100% that he has this problem now?
No, Mrs. Jenin, only after noticing some of the special features on Billy, we are suspecting, but for confirmation, we have to do some blood test on Billy. So we are not quite 100% sure that Billy have this Down syndrome, but usually babies who have these special features, they usually have this syndrome.
Okay, so do these children have any other problems, doctor?
Yes, so we see that commonly babies with Down syndrome usually have some other medical problems which may relate to the heart. There might be problems in the neck gland, that is the thyroid. There might be problems in the eye, and there might be problems with hearing as well.
Okay. Okay, so that means my baby may suffer lots of problems. You're telling heart problem and all. I know that children with heart problem may die. So do you think Billy may die?
Janet, but the good news here is that Billy is now not having any heart issues. And although there might be some medical problems in babies of Down syndrome, but with the advancement of this medical science and with the involvement of specialist doctors, we can really tackle most of the issues and help babies with Down syndrome to lead a very normal life. Jenny?
Okay, doctor, but I don't know. I feel that any baby who have these problems like this, these syndromes, what you are telling, I feel that there will be some problem in the brain. Do they have any problem in the brain?
Yes, Jenny, you have rightly said that usually these babies have some problems with learning. They have some learning difficulties. And for this also, they will require help in getting assistance in learning. So for that also, Jenny, we have special schools and we are here to help you and we will guide you in every
3 minutes
step.
left. 3 minutes.
As Jenny, we will guide you in every step as Janine becomes older.
Okay, doctor. Do you think my other babies also can have this condition?
Yes, there is every possibility, Jenny, that if one baby has a Down syndrome, there is a risk of other babies having the same condition. But that risk will depend on the type of genetic problem the first baby has.
Okay. So I mean to say I was going for regular scanning and all. Why the doctors did not tell me that my baby has problem when she was in tummy? I did not know this. I was going for regular scanning.
Okay, that was very nice, Jenny, that you had regular scans, but sometimes the scans may not pick up the defect because these are only screening tests. They are not diagnostic tests, and sometimes they may not pick up the defect. So sometimes it is possible to miss the defect and they are diagnosed only after the baby are born with special features.
Okay, so for if I have further babies, there is any option that it can be prevented? Doctor, now I am worried.
I know this is a lot of information to take at one go, and if you are planning for a next baby, the best option will to get a genetic counseling before planning the next baby, who will explain in detail how to progress with the pregnancy if you want another.
Okay.
So Jenny, I think I have given you a lot of information in one go. Probably we might have a second meeting to discuss any further concerns that you may have regarding Billy. Will that be okay?
Yes, doctor. Yes, now I don't know how should I proceed with my baby. You are telling you will do some blood tests and maybe I have to, I thought I will be discharged as soon as possible from the hospital.
Yeah, we will try to help you with Billy as much as possible. We will do the blood test and report, get back to you as soon as possible. And in the meantime, we will again arrange a meeting so that we can help about discussing about Billy's further medical condition. And also I will try to give you some leaflets so that you can learn more about this Down's condition.
Okay, doctor.
Thank you so much, Jenny.
Summarize, please.
Thank you so much, Jenny, for meeting me. So today we have discussed about your little daughter Billy, and we are suspecting she's having a Down syndrome, but we need to confirm her with her blood test. And also we discuss about some problems which are anticipated in such babies. But we are here with all our medical staff and our specialties to help you grow, to help Billy to lead a quite a near normal life. Thank you so much, Jenny.
Thank you. Okay, I will first give you the feedback. I don't know whether you asked about the attender or not. I am not sure. Did you ask any attender?
I don't think so. I forgot, I think.
Yeah, you did not ask. I have put question mark here. Okay, you asked about the previous knowledge. You congratulated. And I think you asked some questions for her, which is not allowed in communication. Like, how do you think her eyes, or how do you think? No, you will explain yourself.
Okay.
The unusual features, because in communication you are not asked to ask any question to the mother.
Okay.
Okay, you got my points. I think
Yes.
cases you wasted time in asking her questions, and she was just telling that I thought she's small, that's why she's looking like that. She'll go. Many times this happens, you know, some children look chubby and swollen when they are small, and when they grow, they're big. This is her perspective. You will not ask her that how she's looking, how she, no, you will yourself think that her features are like that, and you can describe that they will have some upslanting eyes like this. Okay, these features we saw in your child. That's why we are suspecting this condition. Yes, a blood test will be sent. Okay, and I don't know if you did any jargon or something. I did not write anything. Okay, so anyone catched any mistakes can go ahead. The only thing I want to tell you is, and also the empathy, sympathy, you should show more, because in Breaking Bad News, whenever she says I am feeling bad and do I have other children also, you should show some empathy and sympathy more. Okay.
Okay.
This thing. And genetic counseling, I don't know. You can explain her what is genetic counseling. Did you explain?
No, I told that before the pregnancy, she can have a genetic counseling.
Yeah, but you have to explain that. See, and also when she asked you how often, we should know the chance of recurrence. I have forgotten. Okay, but even if you have forgotten, you can just tell that we all know that the chromosome translocation form which runs in families is less common. Okay, the more common is non-disjunction, right?
But can we tell those terms? Translocations, non-disjunction to a mother?
No, you will not tell, but I am telling you, it is not very common to recur, but we will do some testing, blood tests on you, on you and your husband, or on you and your partner, to check the cause. Okay.
Yeah.
Check the cause, and we will know, we will do some blood tests on you and your partner to check the cause of this condition and how often it can recur in your babies like this, and we will guide you like this. For genetic counseling, if you use genetic counseling, you have to explain to her. Okay.
Okay.
This is what I wanted to tell. Let us see others' comments. Others, did you catch anything? Please go ahead.
Dr. Noor, I think for offering a test to the parents, you need to have established the type that the baby has, the type of Down syndrome. If it's non-disjunction, then you do not have to offer the test to the parents.
Yeah, that's what when she asked about the recurrence, still this baby is not diagnosed what type, right? So yeah, as you said, we can tell after doing the blood test on the baby, if needed, we will test the parents also and guide them. This is what we can tell if needed. And it is rare. We can say that it is rare. Okay.
Okay.
Okay, regarding the drawing, someone said in Breaking Bad News, no need to draw. There is nothing like that. The last scenario was Breaking Bad News PDA, and we draw to make her understand, right? It's okay. But for me, I feel it's better to draw because they have to understand. So you can tell them that in our body, we have a genetic material called chromosomes. Okay. And we can tell that each cell is an unit in our body. There are small units in our body called cells, and each cell will have genetic material in it. We call them as chromosomes. And there are how many chromosomes? 46, right? 23 pairs. So there are 23 pairs of chromosomes. So in Down syndrome, what happens? We have extra genetic material. Okay. In chromosome 21, we have extra chromosome, which is the cause for this syndrome. You have to explain what is the cause for this syndrome. Okay. And they may ask if it runs in families or not. As the doctor said, you can say we will basically do the blood test on the baby, and then if we have any doubt, if it is due to running in families, we will test the parents to tell you the risk for the next baby to have the same condition like this. Okay, if anyone wants to add anything to this explanation, please go ahead. Yeah, in Breaking Bad News, attender is very important. Just go through because Down syndrome is very common. If not here, it can help in some other place. The percentages, like I think non-disjunction is the most commonest way, and other two like the translocations and how often it occurs, to reassure the parents that it is not common. Okay.
Your tone, your confidence, but please change the tone of your voice, because there is one candidate, and he is very impulsive. He was failed because they're saying you'll behave like as and you are trying to underestimate the patient. So change the tone of your voice. It helps you a lot, especially in
Oh,
communication.
okay, thank you.
So this scenario, I did not, no one opted to be the candidate. So I will be, but I want anyone to be the role player. Huh? Just I will go through the scenario and then let me know. So a pediatric registrar in District General Hospital, side room in pediatric day unit. You are talking to Miss Bartley, mother of 2-year-old Jessica. Background information. Jessica has attended the pediatric day unit with 3 to 4 day history of coryzal symptoms and wheeze. She has seen by your SHO who has made a diagnosis of viral induced wheeze. On admission, Jessica was pyrexial and was given a dose of paracetamol. As the registrar, you are asked to review her. When you look at the drug cardex, you query the dose of paracetamol. It transpires that weight recorded by the admitting nurse was incorrect, as the scales has been set to pounds instead of kilograms. The dose of paracetamol was then worked out as 15 mg per kg, but on a working weight in pounds instead of kilograms. You need to talk to Jessica's mother and explain that there has been drug error, how it occurred, and what your management will be now. So points to consider. First, introduce yourself and make sure that a nurse, preferably one who was involved in Jessica's care, is present. Ask Miss Bartley if she would like her partner or friend or relative to be with her during discussion. You need to be honest, open, and explain exactly what the drug error is and how it occurred. Reassure that Jessica is very unlikely to come to any harm because of the increased dose. Explain what management will involve. In 4 hours' time, you will check paracetamol level in Jessica's blood. Again, emphasize that you expect it to be normal. You can then go on to explain formal procedure of filling incident forms informing senior nursing staff and consultant responsible. Aim to assess the risk and try to minimize any future risk in other children. The incident is being taken very seriously and apologize to her that this has happened. She can put her concerns in writing if she feels that this is more appropriate. Reiterate the fact that she does not need to take this further if she does not wish to, as you can ensure that you will be taking all the relevant steps to try to prevent this from happening again. Concentrate on Jessica being well. We have realized mistake and will work with the department to minimize future risk. Often her contact details, PALS, patient advice and liaison service. You can invite her to meet with the consultant and senior nursing staff if she have opportunity to discuss her further. Okay, just wait 1 minute. Okay, let me keep, no problem. Okay, you're ready. We will start now.
Yeah, we can start.
Good morning.
Good morning.
This is Dr. Noor, one of the children's doctor in this hospital. Am I with Miss Bartley?
Yes, I am Mrs. Bartley.
I am here today to talk to you about Jessica. Do you want anyone to attend this session with you?
No, thank you.
Okay. Can you tell me about Jessica's condition? How is she?
She's fine. Now she's better than before we came here. And we are using medication as you prescribe at appropriate time. Is there any problem? Doctor, why you called us?
No, yes, I want to tell you some important thing about Jessica. That's why I called you. Actually, Mrs. Bentley, what happened is when we are giving medication to Jessica, which is paracetamol, accidentally by mistake, a double dose is given for her. I am so sorry for that, and this is why I arranged a meeting to inform you about it.
Dr. Noor, what type of talking you are talking about my daughter? You people have given a double dose to my child and you are saying it's by mistake, by chance? I will sue you, all of you people, and I will go there. Who is responsible for this thing?
I am so sorry, Mrs. Bentley. Actually, this mistake happened, and it's not one person's error, it's a system error. The whole system is involved in this mistake. We cannot point out one person. I'm so sorry for that. But at the same time, I want to assure you that we are monitoring Jessica and taking care of her to see if any side effects happen. Are you
No,
with
Dr. Noor, please, yeah, I am with you, but please tell me the name of the person who is responsible for this misconduct. I will sue you people. I'm not going to treat anymore. How you are saying that first you did a mistake and now you are saying I will come back her and to bring my child again and to treat her again. Do you think is it suitable?
I am so sorry. Actually, we have calculated the dose, okay? And the dose what we have given extra is not in the toxic level, but still we will monitor Jessica just to be sure, okay? And we will not give the further dose of the paracetamol for her till we will do some blood test for her to check the level of the blood, and it will be done at 4 hours. Before we get that, we will not give her further dose. So we are doing the best for her from our side. So we are
Dr. Noor, I don't want to talk to you. I need some senior person to talk about this issue. I'm not satisfied with you people. The junior people are here to work, and you know the life of my daughter is more precious. So can you arrange a meeting with your consultant immediately?
sure. We will arrange a meeting with our consultant as soon as possible for you, as per your right. But at the same time, I want to reassure you that we have filled an incident form for this. That is, we have informed our consultant and senior nursing staff, and we have filled the form that this should not be repeated with any child further. Am I clear with you?
Yeah, I can understand you now. But tell me how you monitor my daughter.
So as I told you, we will be continuously checking her temperature, her pulse, okay? A pulse means her heart rate. We will check her heart rate, temperature, oxygen. This we call it as vitals. We will keep on checking her. And at 4 hours, we will take the blood test for her to see the level of this paracetamol in her blood. And then we will decide over. Presently, she is stable.
Okay, is there any other medication that we can give her to avoid the side effects of that medication?
It's a very good question. Actually, what we do is, if as I told you, we will always calculate for the toxic dose of the child. If the child has received toxic dose, then only we will go for any medication. From our calculation, this is not toxic dose. So we will wait for 4 hours blood levels, and then only we will decide over. Am I clear to you?
Yeah, I clear you, but I need your consultant immediately.
Okay, we will arrange, we will call him and arrange a meeting for you. Do you have any other concerns?
I just want to know the procedure. How can we how can we
Raise complaint.
sorry, yeah, how can we register a complaint against you people?
Okay, as I told you, we have done an incident form. At the same time, you want to raise a complaint. There is a center in our hospital, what we call it as patient advice and liaison service. I will give you the link, a link and the contact number, how you have to connect with these services for this purpose. Okay. At the same time, I want to reassure you that we are taking care of Jessica. We are monitoring her. She's presently stable, and we will see to it that she will not have any problems related to this.
Okay, thank you.
Okay. So, Mrs. Bentley, what I will do is I will give you some leaflets and trusted websites related to whenever there is a drug overdose, or whenever there is specifically for paracetamol, you can go through it. And if you have any concerns, you can come back to us. And as per your request, I will also arrange a meeting with our consultant shortly. Okay. So I will summarize to you what we discussed. Today we discussed that Jessica has been accidentally given double dose of paracetamol due to miscalculation of weight in pounds instead of kgs. And I want to reassure you that we will see to it that we will not repeat this again. We have filled an incident form for it, and also I will give you the link for the patient advice and liaison service where you can raise your complaint.
Okay,
Thank you.
thank you. Time up. Yeah.
Yeah. Time, just few seconds left. So give me the feedback. I don't know how it went.
Now it's going right way. I think so. There is nothing to left. It's very good. Nothing for me. Nothing is left. Everything you covered, and for this one, it's okay. And my request is this one: if any of them in the group has the mark sheet of RCPCH, and it's better everybody is go through. If somebody is going, just like Dr. Noor, me, Dr. Ruhail, or any one of the candidate is ongoing, please mark on that sheet. I can also try to find out if I can get. So we need to rehearse ourselves according to the mark sheet, so we can get the maximum benefit and maximum mark in the exam, and we can identify our mistakes at the same time.
Yeah.
According to the that sheet, because that is our main mark sheet and main points that we have been assessed, inshallah, very soon.
Yeah. I agree with you. And one more thing which I did mistake, I realized was I just told double dose, but in the scenario it is mentioned that there is miscalculation of pounds instead of kilograms. Even that I have to mention to the mother when I was telling in the starting, which I did not do. I told it in the last. Actually, whatever they give in the scenario, in the opening statement of the scenario, we should tell the same thing to the mother, open and transparent. Okay. Here the mistake, drug error happened due to mistake in calculation of the weight.
On to calculate, yeah.
Okay, due to mistake in weighing scale, the weighing scale was set in pounds, and the drug was calculated for kg. Okay, this is one thing I have to tell it transparently. This I did not do. I just told double dose. And another thing also I have to tell the mother when I am reassuring that we will see to it that we will check our scale. We have already checked our scales and corrected our scales, and we have made an incident report, and this will not be reported. This point also should be told. Okay.
That's good.
That means the scales have to be always in kg. If we are calculating in kg, that has to be set properly. This is what we have to tell. Means we have to give her the solutions to what the mistake happened. One is the incident report, and involving the consultant and the nursing supervisor and the all staff, you can tell, and all department staff, a meeting will be arranged so that this mistake should not be repeated. And scales are checked and corrected already. Like this, you can tell after the mistake it's corrected already. and we will not repeat it like this. Apologizing 3 to 4 times and referring her to PALS if she insists for complaint. Okay.
Dr. Noor, one thing more, we have to say that the consultant is in the way, because there are two situations, and one is non-accidental injury, and second one is this drug error.
Oh.
We have to say the consultant is in the way, and he will be with you in just a while, because you know the situation of the parents in these two occasions. The parents always want to do something, either to escape or either to blame you more and more.
Okay, fine.
Doctor, what's the other situation other than consultant on the way?
Non-accidental.
Okay, tell.
Yeah, non-accidental injury and this drug error, any misconduct.
Incidents.
Yeah.
Any critical incidents like drug error.
Oh, okay, thank you.
Okay, we are done with our target scenarios. See, the reason to do Rebecca is even though this is old book, there can be scenarios even if they don't come exactly same as Rebecca, but if it comes in the exam, like if it is critical incident, you can follow the same steps as we did today. If it is breaking bad news, you can follow the same step as we did today. So it is for the steps. We should know how to follow the steps. And important thing in communication, don't ask the questions. Imagine that this is unusual features of Downs. You will explain the unusual features of Downs to the mother. These are the features we are seeing. That's why you're expecting. We will confirm with the blood test. And she wants to know what is the genetic deformity. You can draw and explain to her, but in a simple language, and make your drawings very simple. This is what I want to tell you in today's things. But whatever, just go back and check for the PDA, some leaflet, and go through it for the recent updates. And for Down syndrome, just go back and check for the unusual features, and also for this non-disjunction and all those things. Okay, that's all. So if no comments, we can end the meeting. Any comments? So let me just tell you all about today's cases. Today's cases, there was inflammatory bowel disease. I think recently we did in our meeting. And also there was cyanotic congenital heart disease, which we had already